Your Royal Highness, my lords, ladies and gentlemen. Firstly, I would like to thank the organisers of the National Equine Forum for, at such short notice, giving me the opportunity to present the work of the British Equestrian Federation High Health Steering Group. Our first group meeting was actually only on the 5th of February this year, and our brief was to promote the understanding of and action biosecurity, otherwise known as good habits, to prevent the spread of infectious disease across the whole of the equestrian sector. We endeavoured to engage with all equestrian stakeholders, which was quite a challenge, but between us we had the wherewithal to contact all the people or bodies that you can see on the screen. And in particular, I would like to say that not one single person whom I contacted ignored the request for help, either in attending the meeting or a lengthy conversation by telephone prior. Please note that the Hunting Office, which represents all hunts in the UK, the Hurling and Polo Association, and the Worshipful Company of Farriers were all represented at our meeting, which quite frankly was truly splendid. And you'll note that the outbreak occurred just 2 days later. The horses. BETA, the British Equine Trade Association survey from 2015, and Claire Williams will outline the latest survey this afternoon for 2019, shows us that there are approximately 950,000 horses in the UK. And of these, at that time, they were made up of race horses in training of 15,000, breeding thoroughbred of 15,000, total of 30,000, hunting and show jumping each approximately 66,000, and eventing 124,000. Therefore, 75% of the horses in the UK and their associated carers have no affiliation to any educational body. At our meeting on the 5th of February, there were presentations from the BEF, the Thoroughbred Breeders Association, the Animal Health Trust, British Horse Society, and the FEI. And this was followed by a roundtable discussion leading to our understanding of the problem. The problem is the majority. Those persons who care for our horses who are currently unaware, through no fault of their own, but they are simply unaware, and they are difficult to reach and to trace. The group formulated proposals and actions, namely that all sections of the equestrian industry should unite with a common interest and for a mutual benefit. And we promoted two main areas upon which to concentrate. The first being education of all stakeholders, re effective husbandry to prevent the spread of disease. Simple, very important, absolutely our prime reason for being. And secondly, an emergency response committee for the rapid response to giving guidance in the event of a disease outbreak. Because the flu outbreak occurred only 2 days later, this was very immediately established, up and running, with ongoing advice from Richard. Your Royal Highness, ladies and gentlemen, we do owe Richard and his flu team a huge debt of gratitude for the amount of work that they have done to get us, or getting us, back on track. Much ongoing work has been done by our group since our meeting. We've had regular updates, and these have been actioned. And the next group meeting is in early June. However, the single most important outcome of our deliberations to date is that equine influenza is a wake-up call for all of us of the impending exotic diseases. It is not if, it is when these diseases will arrive in Great Britain. We have a naive population of horses. They have no immunity to these diseases. We will have equine fatalities, compulsory movement restrictions, and slaughter. We must reach out to every single horse carer in the UK to continue the work that has already been so efficiently demonstrated during the current equine influenza outbreak. And this has already started. For instance, farriers, within a few days of the outbreak, all over the country were wearing white coveralls to raise the awareness of biosecurity to every horse owner. And we must promote good biosecurity habits. Your Royal Highness, I do believe that actions related to taking collective responsibility can be a very powerful tool in enhancing disease prevention. Thank you.